Well, Team San Diego is part of a larger initiative here in San Diego that we've been working on since 1999, and that's to improve the service delivery for older adults and people with disabilities and those with complex chronic conditions.
The reason why coordinated care for people with chronic conditions is very important is our current service delivery system is not coordinated. It's fragmented, and there's lots of different well-meaning programs, but they're siloed, and folks have multiple conditions, and sometimes very difficult for them to know how to navigate.
And because they're not in any sort of a managed health plan, they don't have any opportunity for care coordination. The virtual team is encouraged to establish a method of how they are going to communicate with one another, share information about the mutual patient or client that they serve.
And so this virtual team is communicating with one another, has been trained together, have trained and understand how to coordinate the different services that they provide with one another, so it's seamless to the client, to that person with a chronic condition.
One of the tools that they are given is the Network of Care web resource.
It's a comprehensive internet-based community resource for older adults, people with disabilities, their caregivers, family members, and also service providers.
Through an individual's personal health record, the virtual team can upload assessments, care plans, and notes, and that information can be shared not only with the individual with chronic conditions, but with everyone that individual grants access to their personal health record.
The four key areas that are featured on the website is the service directory, the library, there is a long-term care options counselor, and also the My folder. In this section, a person is able to kind of log in and create their own electronic personal health record, and they can maintain it online. It's a secure website, and the person has the ability to enter emergency contacts, medical history, medications. The great thing about this is that they're able to share this and grant certain levels of access to family members, service providers, and care managers. So this is really care coordination at its finest.
Let me give you an example. MSSP, the case manager, was out visiting the client on a regular basis, and she was doing fine in her home. The case manager helped this person to get to her doctor by providing assistance with transportation, worked with in-home support services to make sure that the caregiver was arriving and was providing the care that was necessary. Sometimes works with family to coordinate the care with a family member who's maybe grocery shopping. And this client went into the hospital. She had an issue with hypertension and diabetes, and I believe also COPD, which is breathing issues. When she got out of the hospital, a nurse and a care manager who worked together on the team went to visit her to reassess her needs. At that time, they found the client taking a double dose of her medication for hypertension and diabetes. A lot of times when people get out of the hospital, there's a high risk of medication errors because they get new orders from the hospital when they leave, and they also remember what they were taking prior to going into the hospital. So they reviewed the medications, and they realized that this one was in real big trouble because she was taking too much medication. They got it all straightened out. They contacted the doctor and let the doctor know. But I think without that service, she would have absolutely been back in the hospital pretty quickly.
Perhaps one of the most profound results that has come out of Team San Diego is the awakening of the providers that have gone through the training.
Team San Diego was really designed to bring all of those formal and informal caregivers that touch the lives of someone with a chronic condition together.
To actually realize that they are able to better serve the clients with this coordinated effort in broader community, beyond the walls of the physician office, but also with community coming together.
To improve communication, to coordinate care, and to activate individuals with chronic conditions to better manage their own health.